Major regulatory changes are about to hit products Canadians use every day. Health Canada's proposed new labelling and fee structure will force small businesses in the natural health product industry to make unnecessary, costly changes, forcing a tsunami of consequences on the industry and Canadians. President and CEO of the Canadian Health Food Association, Aaron Skelton, on the impact and the ask.
If you had Minister Holland sitting in front of you right now, what would you say to him?
Minister Holland, 80% of Canadians use an NHP on a regular basis. These are not niche products. These are vitamins, minerals, toothpaste, deodorants. And what Canadians have been asking you to do is to stop these proposed regulations and reevaluate how best to move forward.
The Canadian Health Food Association says part of the government overreach is forcing even more regulations on an already regulated industry, and they are doing it without considering the impacts on small business.
Canada's got one of the best NHP regulatory frameworks in the world, often seen as world leading. Unfortunately, what's happened with what Health Canada has proposed over the last few years is a piecemealed approach in terms of updates and changes that are really going to have a negative impact on Canadian businesses. The NHP industry is significant. It's $5.5 billion. But these are primarily made up of small, medium, micro businesses that can't really adjust to some of these changes that are being proposed.
You have data to prove how these brands are feeling.
Yes, unfortunately, the research that we've done back in 2022 on just the back of the labeling updates showed us that 1 in 5 of these brands was considering leaving the country. You know, these family businesses that have been supporting their local communities have, hard decisions to make on whether they stay in Canada or they leave.
Are there campaigns underway to lure Canadian businesses out of this country?
I would say shockingly, but maybe not shockingly, there are. Many states are now courting Canadian businesses and endorsing their move to a U.S. state. We've had 2 members already that have made the decision to relocate to the U.S. They can still sell into Canadian consumers through those online marketplaces, and we think that's really undermining sort of the work that's been done in this industry for so many decades.
Is there then a domino effect if these brands leave the country on retail?
Yeah, ultimately, it's the entire value chain gets impacted. So the brands and the businesses are challenged on whether they can, stay viable in Canada. So Canadians from, communities from coast to coast to coast are going to see less products on the shelf from Canadian businesses, and the products that are on shelf are going to be cost them more.
You've been advocating on behalf of your industry for over a year on this, starting with the SOS Save Our Supplements campaign. Do you feel the government is taking your concerns seriously?
Many of the MPs have been open to conversations, and they're starting to really hear from their constituents, their concerns from Canadians about the impact of some of these changes. We believe consultations is an important part of any process in terms of updating regulations or any changes to such a large stakeholder base. Unfortunately, what we felt has been more performative consultation than truly meaningful consultation. And at the end of the day, Health Canada has made statements that regardless of the feedback, they're planning on moving forward. We feel that NHPs are a critical part of the healthcare system, empowering Canadians to take some autonomy in how they manage their health. But to do that, you need products that you can trust, you need products that are available, and that are available at a good price.